Good morning, friends. So, diabetes, there is two types of complications. One is acute complication, another is chronic complication. Regarding chronic complication, we have discussed many times as it affects all organs. It can affect eye, it can affect your kidney, it can affect your nerve, and accordingly the diabetic neuropathy, nephropathy, these things will happen. But what about the acute complication? So there is three acute complications. The first very common complication is hypoglycemia. If you have diabetes and you are taking insulin or you are taking any medicine, then your sugar level will fall below 80 and that will cause hypoglycemia, and that is very dangerous. Immediately you have to take plain sugar or chocolate or ice cream so that your sugar level will be increased. Otherwise, your brain will be collapsed or brain will be die because of lack of the sugar. The second most acute complication is diabetic ketoacidosis. If there is prolonged uncontrolled hyperglycemia, that means if your sugar is not controlled by taking insulin or medicine, then that hyperglycemic condition leads to production of the ketone bodies inside your bodies, which are very toxic, and that is called diabetic ketoacidosis, and it will cause sudden fall, unconsciousness, and that may lead to the coma. That is called ketotic coma, and there will be fruity odor in the mouth because of the excess ketone bodies inside the body. So that should be addressed on an emergency basis, and patient need hospitalization. That cannot be managed at your home. So suppose you have a diabetes and it is not controlled, and suddenly you will fall, you are falling, and there is a fruity odor coming. That signifies you are suffering from diabetic ketoacidosis, and immediately you need hospitalization. And the last, and also in diabetic ketoacidosis, your sugar level will be very high. That should be on random sugar, that will be 500 and 600. Then you will definitely suspect that is a diabetic ketoacidosis and patient need hospitalization. And the last acute complication is hyperosmolar coma, and this is also a very dangerous condition, and many times the osmolarity of the body is rise and the patient will fall into comatic condition, that is called hyperosmolar coma. And in this condition also sugar level will be raised to 700 or 800. So these things also patient need hospitalization. Any diabetes patient should aware about all these complications, because acute complication that should be managed immediately. And if you are taking medicine or insulin, you are very prone to, especially glimepiride, that is or sulfonylurea type of drugs, they are more prone to develop hypoglycemia. So if you are taking medicine or insulin, then definitely be aware regarding hypoglycemia and be prepared. Even if you are doing exercise or yoga, also you can develop into hypoglycemia. And if you want to refrain from all these complications or prevent all these complications, then you have to join our lifestyle program, in which we taper your drugs or insulin in gradual way, and your all medicine will be gradually in a 1 month duration or 3 month duration will be stopped, and your sugar level will be in a control level or normal level. That is called diabetes reversal. And once you join this diabetes reversal and reverse your diabetes, then definitely you can avoid all these type of complications. So friends, if you want to join our program, then kindly click in the link given below, and if you like this video, then share and subscribe our channel. Thank you.